What are some of the common misconceptions about cathing with spina bifida that you'd like to kind of address or clear up for people?
Some people with spina bifida um, don't necessarily have to use a catheter all the time, but they might, and they think that if they void on their own, that they are getting everything out. But that's not true. Sometimes you're not emptying your bladder all the way, and that's
Mhm.
how you get. And those of us that if you get a lot of kidney infections, you're probably not emptying your bladder all the way. So they've got to understand, um, and that's not just I don't want to use the word normal, but a person in the world who doesn't cath that is not a medical professional. These sometimes are nurses and people who don't know what spina bifida is, even though they're in the medical community. They don't always understand what the importance of a catheter is. Um, Sometimes people think that if you cath, then you're not going to leak, and cathing makes everything perfect, but that is not true. Sometimes when you cath, you are not able to get everything out, and that leads to issues, or you don't cath enough, and then you have leaks. And so cathing is a great way to empty your bladder, but it is not 100% foolproof.
Right.
Um, some people think that, and it's probably like the kids and teens think that cathing is kind of gross and not, but if it's not, it's clean. It's not, um, it's hard to get them to understand then. And a lot of people think that if you say you're cathing, that you actually have an external bag.
Right.
They
Right.
don't understand that, no, you're just putting a catheter into your body to empty your bladder. They think that there are external bags, but just because you're cathing doesn't mean that you have one of those. Let's see. And some people think that if you catheterize yourselves, then you are limited in your physical abilities as far as participating in sports or other activities. And that is definitely not true. Many wheelchair athletes that play wheelchair basketball, wheelchair rugby, all kinds of sports like that, cath, and they function just fine.
Yeah. They definitely can keep quite busy, all within managing all these different things. So, thanks for kind of addressing those, and kind of, even someone like myself, I've worked as a nurse, I've done these things, but there were things that you just mentioned even that I wasn't thinking about some leaking and things like that, and it kind of paints a better picture of what this patient or this child looks like, and some of the additional challenges and why they have these additional supply needs, and that all adds up and things like that.